we've spoken a lot about valvular issues, right? So when we came talking about pulmonary valve, we got to see that there are different type of stenosis that could occur to it. Stenosis simply meaning the valve is no longer flexible. Do you understand? So it's resistant to blood flow. So just want to look at two types of this stenosis. There's a type of stenosis which is known as what? Infundibular stenosis. We have one which is known as subvalvular stenosis. All of them, they are pulmonary stenosis. But of course, these ones, they are occurring at different positions. Do you understand? So infundibular and subvalvular stenosis, we see that they are type of pulmonary stenosis. Pulmonary stenosis simply means there is a narrowing that obstructs blood flow from the right ventricle to the pulmonary artery. So from the right side, okay, blood is supposed to go right here back into the lungs, right? But if there's anything that is obstructing the blood flow, okay, that's what we call pulmonary stenosis. Of course, obstructions could occur at different positions. Do you understand? That's what brought the classification. So for the infundibular one, it occurs in the infundibulum, which is the funnel-shaped portion of the right ventricle outflow tract, just below the pulmonary valve. So can you see this place? If there's any obstruction here, we call it the infundibular stenosis. So associated conditions, like you see it in things like what? Tetralogy of Fallot, very common. Okay, can also occur as an isolated issue, just it appearing. So you hear things like mild murmurs, sinuses, the skin is blue, everything. If you tell the person to do any exercise, the person is not tolerant to it. Subvalvular stenosis now. This one is just beneath the pulmonary valve, but not necessarily in the infundibulum. Okay, so you could say the infundibulum is way down. So subvalvular could just be, they're almost the same thing. That's why we even discuss them together. Do you understand? So mechanism may involve fibrous, ridges, muscular thickening, membranous obstructions, overlap. Sometimes it's used interchangeably. That's why I said they are almost the same thing. So diagnosis of those echocardiogram, MRI, CT scans, cardiac catheterization. Treatment options: if it is mild, just keep monitoring. If it is severe, they can now use, they resect anything that is obstructing that place, or they can use a balloon to keep the place open so that blood is keep flowing to the lungs. So in Tetralogy of Fallot, they do some other special surgeries for that Tetralogy of Fallot to correct it. Okay, so that's it for these two types of pulmonary valve stenosis.